After you finish this lesson, you will be.
All right, so we're gonna first talk about basic communication, types of communication. All right, so our objectives are to define communication and its role in the healthcare industry, distinguish among verbal, written, and nonverbal communication, understand and use therapeutic communication guidelines. So that's what we're gonna talk about in this section. All right, so communication is a process of exchanging messages. That's what the textbook definition of communication is. Um, you have a few other professions that require the level and range of communication skills that the healthcare industry does. In this atmosphere, accurate communication is vital. Healthcare professionals must communicate effectively and appropriately with other healthcare workers, patients, and clients, and their families, their students, their visitors, administrators, and business contacts. The greater responsibility for communication rests with the healthcare worker. Communication exists in many forms. You have verbal, written, and nonverbal communication. So remember, I'll tell you what to write down. All right, so which of the following is the best definition of communication? Process of exchanging messages. With whom must healthcare workers learn to effectively communicate? So you got coworkers, patients and clients, students and visitors, administrators, and business contacts.
Verbal communication.
All right, so you have verbal communication. It's the use of language and words to send and receive information. Verbal communication can take place face to face or over the telephone. It can also occur one to one or in a group. So it might be you just like in this picture, you got a healthcare worker talking to a patient, just one on one. It could be you talking to your boss one on one. It could be like a group of doctors talking to a patient, or y'all could be like in a staff meeting where it's more than one person or more than two people. So it could be, in a small group or it can be in a large group. It's the form that's used most often. It's the most effective as well. It allows for instant feedback and discussion. So what that means is, you can be talking to somebody, you'll get, instant, talk back or feedback from them. Y'all can discuss it. If you do something written, you might have to wait for a reply and all that stuff. So it's not as instant as verbal communication. Verbal communication can also end confusion instantly and bring about clarity and understanding. With the thing with written communication is that sometimes you don't know if somebody's talking to you. You can tell their tone of voice. If you're reading something that somebody's written, you don't know if they're angry. Sometimes you don't know if they're happy. You know what I'm saying? So you can't really tell. That's the drawback with written communication. So the goals for verbal communication in the healthcare environment can typically be put into one of the following categories: establish rapport or connection, obtain information from patients, confirm understanding, relay information to other healthcare workers, and give instructions to patients. So these are all what um, the goals are when you're in the healthcare setting. All right, so on Monday morning, Soraya greets her first patient, Tim, by asking if he had a nice weekend. Soraya is using which of the following goals of verbal communication? Right. So you're going to establish rapport or connection. Because you go Monday morning, you're going to see your patient. You don't just bust up in there and just go to tell him what you're going to do. You at least say good morning. Did you sleep well? Something like that. So she's building that rapport or connecting with her patients. You know how some of y'all they walk in here and y'all just sit down, y'all saying like that. So then I just look at you. Or I'll say good morning. Y'all look at me like I'm crazy. Sometimes. Some people do that. But. All right. Why is verbal communication often the most effective way to communicate?
B.
B. It allows for instant feedback, clarity, and understanding. Remember, I said that's the plus of verbal. You can actually have a conversation. I can say something. She can say something back to me with somebody's phone. I keep going off the hell, so y'all need to check that. And then if it's written, you don't get that instant thing because you gotta wait.
Tone of voice. It has been said many.
All right, so it's not what you say, but how you say it. That's what people, the message people get from tone of voice. This saying refers to tone of voice. A speaker's feelings are expressed through their tone. Healthcare workers' tone is very revealing to a patient. Patients can easily pick up on fear, agitation, calmness, and confidence from a healthcare worker's volume, rate, and pitch. Healthcare workers must be aware of how they sound. If they can adjust their tone of voice appropriately to the situation, it can become an effective communication tool. They can use their tone to calm and reassure patients even if the news is bad. So how you talk to somebody, it relays a message, it communicates things to them. Some people can tell if you're stressed out, they can tell if you're angry, if you're sad, if you're not, if you're distracted, things like that. Along with like body language, facial expressions, and all that stuff too.
Language choice. With
All right, so with all the medical terminology that healthcare workers are required to know, they practically speak a different language. They need that language when conversing with colleagues. However, when interacting with patients, they must translate the medical terminology into lay terms. Lay terms are everyday language that patients can understand. For example, instead of saying lumbar, you'll say lower back. Instead of costate, you'll say ribs. At the same time, healthcare workers must avoid talking down to patients by oversimplifying their language. They should also avoid making noises such as and which are meaningless. Finally, they should be careful to enunciate words and avoid mumbling. The result is healthcare workers that sound professional and knowledgeable. That professionalism builds patients' confidence in healthcare workers. Yes. All right, in verbal communication, how is emotion expressed?
Tone and voice.
All right, you need to write that down. Tone of voice. In verbal communication, how is emotion expressed? All right, what can a healthcare worker do to ensure that a patient understands medical information?
C.
Use appropriate lay terms. You know that one too. That one's on your study guide. So, what can a healthcare worker do to ensure that a patient understands medical information? Use appropriate lay terms. right, so we're gonna look at a little communication scenario. All right, so Michelle works as a medical assistant at a general practitioner's office. Mr. James is Michelle's current patient. Mr. James' last visit was for extreme pain in his lower back. He is now visiting the office for cold symptoms.
Good morning, Mr. James. I'm Michelle, and I'll be talking with you briefly before the doctor comes in to see you.
Hi, Michelle.
So let's see. Oh, it says here that the doctor diagnosed you with acute lumbar myositis.
The doctor didn't tell me I had that.
I bet that changes how you do things in your daily life.
I don't understand. All he said was that I had strained my back.
All right, how was the patient's reaction when he heard he had a lumbar myositis?
You.
He was confused by the medical terminology. All right, because the doctor apparently didn't tell him. He just said like he strained his back. He didn't use, big words with him. All right, what could Michelle have done differently while communicating with her patient? Use lay terms. Huh? The doctor? The doctor communicated.
I'm not talking about that doctor.
The nurse.
No, I'm talking about the doctor that told him he straightened his back.
Well, yeah, the doctor used the lay terms. The doctor told him he strained his back, but she come in using these big words and he got confused. Instead of her just saying, yes, you strained your back. Because he didn't know what that was. I mean, the doctor probably could have explained it, but it's simpler just like, oh, you strained your back muscle. Imagine he elderly, so he probably wasn't going to remember how to say it after that day either way. All right, so using lay terms would have been, better thing for Michelle to do. All right.
Good morning, Mr. James. I'm Michelle, and I'll be talking with you briefly before the doctor comes in to see you.
Hi, Michelle.
So let's see. Okay, I see the last time you were in the office you had some back pain.
Oh, yes, I have a lot of pain.
How's your back feeling now?
My back's much better. I'm much more careful now when I'm working in the yard. I don't want to go through that again. Now, if I could just get rid of this cold.
All right, so in scenario 2, Michelle used terminology the patient understood. True. She just said back pain, and he understood completely what she was talking about. So how did the patient's reaction in scenario 2 differ from his reaction in scenario 1? He understood better. He wasn't confused because she said back pain, which was easier to, understand than big words.
Therapeutic communication.
All right, so patients communicate through both verbal and nonverbal communication. Therapeutic communication is patient-centered, in which the patient is looked at as a person. Therapeutic communication results in improved patient satisfaction as well as improved health outcomes. As a result, quality patient care depends on excellent therapeutic communication skills. When you communicate with a patient, it's important to remember that you need to stay within your scope of practice. So, you're a nurse, you have things that you can and cannot do. Can't do everything that a doctor does. If you are a lab technician, you have to stay within your scope of practice. You can't do things that a nurse does or x-ray tech does. So you have to remember that. Even, because patients will ask you anything if you come in there with scrubs on. They think just because you wear scrubs that you either a doctor or a nurse or you know everything about everything, which is not true. So, best thing I should say was I'm not sure. I'll ask whoever, or try to find out. Because they don't care that you don't work in whatever department. They just going to start asking you questions or, thinking you know the answer to everything. So any questions you ask a patient must fall within the scope of permitted questions and boundaries for your field. So whatever you're trained, went to school for, study for, that's what you can talk about and elaborate on.
Therapeutic. Therapeutic communication guideline.
All right, so when you communicate with the patient, these are the guidelines you should follow. Develop a rapport or a type of positive relationship with the patient. To develop a rapport, act and speak in a calm, confident, and confident manner. Speak clearly and slowly. Introduce yourself to the patient at the start of the conversation. Ask the patient what he or she wishes to be called and refer to the patient in this way. Use language the patient can understand and avoid medical jargon, codes, and abbreviations. For example, don't ask what is your chief complaint, instead ask what's wrong. Show leadership, but do not be imposing or give advice. Be honest with the patient, don't provide false assurance.
Therapeutic communication guideline.
All right, so you should use open-ended questions. An open-ended question requires more than a one or two word answer. As a result, answers to open-ended questions are descriptive and revealing. Examples of open-ended questions are what happened and how do you feel. Do not ask why questions. Because you want them to be able to like describe or give you more information as to what they're asking. So you'll use closed questions only when specific information is needed. A closed or direct question requires a simple one or two word answer, often yes or no. Examples of closed questions are you having difficulty breathing? And when did you last eat something? Be sure that the question does not lead the patient to an answer. For example, do not ask, do you have chest pain? Instead, ask, do you have pain anywhere? Ask the patient one question at a time and don't interrupt them. So if you have somebody that's coming in complaining of like pain, you want to ask them because you want to know exactly where they're having it. You don't want to give them an answer by saying, do you have chest pain, for them to just be like, yes. You want them to tell you where they have, their pain at. Allow the patient enough time to answer a question before asking the next one. Listen carefully to what they say. Acknowledge what the patient says with responses such as, I'm listening, I see, and go on. If necessary, take notes so you do not forget information.
Therapeutic communication guideline.
So you should also allow the patient to ask questions, allow the patient to discuss his or her concerns and feelings. Be empathetic by looking at the patient as a person and acknowledging his or her concerns and feelings. Do not focus only on the patient's illness or injury, but also how the illness or injury affects the patient. Ask the patient for permission before performing a procedure. Tell the patient what you're going to do. Apologize for any necessary discomfort and pain. Be aware of your nonverbal communication. When should an open-ended question be used? Huh?
A specific explanation is needed. All the above.
It can't be all the above.
Oh, no.
Yeah, when patients have difficulty speaking.
To attain decisive and revealing information.
So staying descriptive and reveal information. That's open-ended. Which is an open-ended question? You want them to be descriptive, so.
D.
What has been your experience with the care of our staff provides? You ask them that, they're going to hopefully describe how their stay has been or their experience wherever they're at. Because, like, with these questions, you can just be like, can I help you? Nope. What's your favorite activity? Reading. Do you like being a teacher? No. Or something like, you know what I'm saying? They can just answer with, like, one answer there.
Written communication.
All right, y'all line up for lunch. We'll finish this one coming up. All right. All right, so we're gonna look at written communication. It's a form of verbal communication. So depending on the situation, there are benefits to using written communication. So it allows a writer time to research and to organize their thoughts. Additionally, once written communication is completed, it can be proofread and edited before it reaches its audience. So that's important, like even if y'all sending emails, writing stuff down, make sure that you read over it and it makes sense. It not has errors and stuff like that. Written communication must be accurate and clear, and it should be brief with logical organization. It should be free of grammar, spelling, punctuation errors. Finally, written communication should include vocabulary that is appropriate for the reader. Healthcare workers use written communication for the following items: messages and orders, test results, notes and patient charts, informed consent documents, procedures and policies, patient education material, surveys, letters, and memos. So these are all, what we talked about earlier as far as examples of written communication. You need to know that written communication is used to indicate informed consent. So written communication is used to indicate informed consent. So informed consent is like basically documents that you give your patient to say they're gonna have treatment or whatever, surgery or whatever. So written communication is used to indicate informed consent. All right.
Selecting the correct form.
All right, so before using written communication, healthcare workers must first ask themselves if the message would be better delivered orally. So sometimes stuff you need to just, do it verbally, or you can use it as in written form. They should also decide whether or not the message requires a written record. Once it has been determined that written communication is necessary, healthcare workers must decide what format the message should take. The written message could be a letter, an email, report, etc. Memos are typically used for internal communication. Internal communication occurs within an organization, such as between a physician and a nurse. Letters are often used for external communication. Then you have external communication. Those are items that are sent outside of the agency, such as to an insurance company or to the community. Which of the following is a benefit of written communication over oral communication? Right, it can be researched and edited. When selecting the best form for communication, what should be considered? Right, all of them. So should consider if it should be oral or written, what formats, and whether the communication is internal or external.
Writing memos.
Memos are a form of written communication. They are used often in the healthcare industry, both in printed form and via electronic mail, which is email. Memos have some standard parts. So you have the to section. That should include the name of the people who the memo is intended for. You have the from section, should include the name of the person sending the memo. So you're sending it to all your teachers, and you will put their names, and then from it'll have your name. Date should contain the date the memo is created. Subject should briefly state the purpose of the memo, and then the body should follow these parts and includes the details of the message. So even if you're doing an email, which last year, we was basically majority virtual, so I got a lot more emails from students last year. When students are writing email, you need to make sure that you put what's like you have a subject part for your email. Put what it is. If you want to ask about a test grade, want to know about your makeup work, just put that in the subject so I'll know, what to be looking for, or whoever you're emailing know what to be looking for. Because I would just get like emails. It'll just be like, nothing in the subject. I need to take my test. Okay, well, what test? Like you just said, okay, how many tests we had so far? It wasn't specific. So then I'm trying to like email back, like, which tests are you talking about? Or now I'm gonna go look through the grade book and try to figure out, could be all of them because you want to do your work, but So when you do stuff like that, you send any kind of memo, letter, make sure you put the parts in it because it does make it helpful. So if you missed a day and you need to do, like, say somebody missed today, study guide. Okay, Miss Ann heard you got a study guide in class. You could put study guide as a subject, study guide in class on Tuesday or something like that as your message. I need to make it up, or where can I get it up, blah, blah, whatever it is. So.
The 5 W's.
All right, so once a format has been determined for written communication, healthcare workers must write the message using the 5 W's. So you have who is the audience, what is the purpose of the message, why is the message important, when did or will the event occur, where did or will the event take place. So you got your who, what, why, when, and where. Which of the following is one of the 5 W's?
The first one? No, all of the above.
All of the above. Oh, y'all not doing well with these phones. I guess we be back to the bucket on Wednesday.
Nonverbal communication.
Nonverbal communication includes methods used in addition to or as a substitute for language. Nonverbal communication includes the following methods: eye contact and facial expressions, gestures and body language, physical appearance, touch, and proximity. So these are all ways you can communicate without saying a word. I'm really bad with my facial expressions. Like, it's always been like that. So if I don't say it, I show it. So, and y'all don't get the full effect because I have my mask on. But yeah, it's always been bad. So facial expressions, eye contact, gestures, body language, physical appearance, touch, and proximity. Which of the following is a method of nonverbal communication? All of them.
Eye contact.
Alright, so eye contact is one form of facial expression. Direct eye contact usually sends a powerful and positive message. Smile also generally communicates a positive message. However, an artificial smile or fake smile can often be detected by others. Other facial expressions communicate as well. You can have a blank stare, can indicate that somebody has a fever. A grimace can express pain. A bland look can suggest depression. Healthcare workers must be conscious of both interpreting facial expressions in others and in mastering their own expression to be sure that they are sending the appropriate message. Healthcare workers should strive for an open, friendly expression that is neither too solemn nor too cheerful.
Gestures and body language.
What can the tapping of a foot imply? Crossing the arms, waving. In addition to facial expressions, people can communicate through body language and gestures. Body language sends powerful messages to others. At times, people can use their bodies instead of words, such as when someone nods or shakes the head. Posture also conveys a message. People who stand up straight exude confidence, while people who slouch appear unsure of themselves. Healthcare workers must be skilled both in reading and in using gestures and body language effectively. They should be sure to lean forward slightly when interacting with patients. This body language shows interest in the patient. Describe the facial expression that a healthcare worker should strive for. Alright, for all of them. Healthcare workers should lean back and away from patients to appear interested in the conversation.
Physical appearance.
In the healthcare industry, many workers wear uniforms. Their uniforms send a message that they belong to the healthcare field. Depending on the patient, this message can have a positive or negative effect. Some patients take comfort from the image of someone in uniform, while others are intimidated or frightened by it. Healthcare workers must be aware of these opposing views and be sensitive to how they interact with patients based on how their appearance is received. In addition to uniforms, physical appearance is also expressed by grooming. Someone who is well-groomed communicates a positive message. Someone that is disheveled and not properly groomed can send a negative message. Piercings, facial hair, and overdone makeup can negatively communicate to others.
Touch.
Touching patients is required in many areas of the healthcare field. Touch can communicate many things. It can be misinterpreted, which can be a serious matter. Special licensing that is required for healthcare workers provides them with some protection against some misinterpretations. However, healthcare workers must always be conscientious to touch patients with only kindness and respect. Patients can easily detect an inappropriate or uncaring touch. Communication and touch can also be expressed in how quickly and comfortably a healthcare worker moves with the patient. Beyond clinical touching that is required, healthcare workers may also feel inclined to give patients reassuring touches in the appropriate context. In some cases, a kind, consigned hand on a patient's shoulder can communicate far more than words can. And, sometimes you have to touch your patient in order to do whatever needs to be done, but you got to make sure that you don't touch them in any kind of inappropriate way. You've heard stories, I'm sure, of like people molesting their patients or people that are taking care of, like I don't know his name, but he was a coach. Oh, not a coach. He was a team doctor for the women's Olympic gymnast. Been some years ago, but they found out he was like touching them inappropriately and stuff like that. So I think did he kill himself? He want to kill himself. But anyway, he was going to jail, but he was not already there. But they started coming out talking about it, and it was a whole big old situation going on.
Proximity.
Proximity refers to the physical space between people. The distance between people is one aspect of proximity. The appropriate distance between people varies among cultures. Healthcare workers must often invade patients' personal space in order to perform their duties. Sensitivity, professionalism are required when patient proximity is an issue. Proximity can also be communicated through height. In communication between two people, if one is standing and one is sitting, the person who is standing communicates authority over the other person. In the healthcare industry, there are many cases where a healthcare worker will stand over a patient who is seated or lying down. Healthcare workers must be sensitive to how their proximity affects patients. Healthcare workers should sit down as often as possible when communicating with patients. Finally, proximity can also include odors. Healthcare workers who have close contact with patients should be aware of the type of body soap and deodorant they use. They should limit or forego perfume or cologne and practice good oral hygiene. And we talked about, that last time. I need to write this down. Healthcare workers should sit down as often as possible when communicating with patients. Because, if you're standing over somebody, it kind of feels like, you're superior or whatever. Sometimes, they'll pull up a chair and get down to your level and talk to you, explain stuff. And sometimes that makes it better to understand what's going on. As often as possible when communicating with patients.
Proximity. Proximity.
That's all right, Nick. As long as healthcare workers are wearing appropriate uniforms, they need not pay attention to personal grooming and hygiene. Healthcare workers must always be conscientious to touch patients with kindness and respect. Which of the following refers to the physical space between people? Proximity. All right. So what goes under verbal?
Tone of voice.
What else?
Writing.
Tone of voice. What else?
Appropriate vocabulary for reading. Written communication.
All right. Is that it? So all those go under nonverbal?
All this is going nonverbal.
Alright, so for verbal, you got oral communication, tone of voice, appropriate vocabulary for readers, written communication. Non-verbal, you got physical appearance, proximity, touch, facial expressions, and body language.
Lesson summary.
Alright, make sure you keep up with your study guide. We'll go over some more on Thursday. Make sure you keep up with your notes. You didn't get one? Make sure you come and get one.